Minutes. Well, the shutdown fight in Washington mostly comes down to health care costs, and some Georgia families are already worried, especially about Medicaid cuts that started this summer. 11 Live's Grace King spoke with one family who is watching very closely, afraid that these changes could make their health care too expensive.
37-year-old Mariah starts every morning the same way.
In light of the fact that she is diagnosed with autism, structure is very key.
Mariah's strict routine helps her thrive.
You know, she goes to the program, she goes to church on Sunday. It's all very straight. She knows exactly the way it is.
But her dad, Bruce Farrow, says that structure relies on Medicare waiver funding.
If she were not able to get Medicare, Mariah would be at home. She would be at home with us.
In July, President Donald Trump signed the Big Beautiful Bill Act into law that included substantial cuts to funding for Medicare and Medicaid. He worries that'll trickle down to the state waivers those programs fund.
Private pay is an extraordinarily expensive option for any of these things, but by and large, she'd be at home.
As lawmakers make health care the center of their shutdown fight, Bruce worries they've forgotten cuts they've already approved.
These services are really critical for folks who need them. They lean on them. This is their safety net.
In Sandy Springs, Grace King, 11 Alive News.
Now, to put this into perspective, Georgia has thousands of people on the waiting list for waivers like Mariah's, and they rely heavily on federal, not state funding.